If you are of a certain age and not happy with the image that you see reflected in your mirror, there is something you can do about it. Whether you want a small touch-up or something bigger, there are many ways to achieve your goal of turning back the clock. Joining me today is Dr. Timothy Treece. He's from Columbus Aesthetic and Plastic Surgery. Nice to see you, Dr. Treece.
Nice to be here, Gail.
What are the numbers like of people who are going to you for, you call it facial rejuvenation, but I think most people probably know it as facelifts?
Well, the average age, actually, since I've been doing this in the last 22 years, has dropped down and down. And countrywide, it's around 50.
It's around the age, and we're talking men and women, right?
Men and women, more women than men. It's 9 to 1 women to men, but we're doing rejuvenation procedures on women in their 40s at times, and the average age is right at 50 around the country.
Well, let's start with some basics and an explanation of what a facelift is. It is surgery.
It is. We look at people from a global standpoint. What are their general needs? And not everybody needs to have a surgical intervention. So it's just one of a spectrum of things that I offer. But for many people, having some looseness of the skin of the face, loss of volume, a little neck shows up, a little bit of jowls, there's just no way to turn all that back except to remove some tissue and tighten it and lift it.
You know, that jowl, we don't even like the word jowl, especially women. We just don't even like the word, much less what it implies.
Right.
There are a lot of terms too now that people, and I am seeing on TV, in magazines, the quick lift and the lifestyle lift, different names. Are they all the same thing?
No, they're not. They're as different as people's faces are.
Really?
And it's interesting because the most important message I can give people today is pick a surgeon, not a technique. There are good techniques out there, but techniques are all different and people's needs are all different. And what you want is to have the artist and the scientist that looks at you as an individual, hopefully a board-certified plastic surgeon, and don't be confused or sucked in by slick marketing techniques. The quick lift and the lifestyle lift are very beautiful ads. They're well done nationwide marketing strategies. But what you want is a good surgeon that's taking care of you, someone you trust.
I think that was interesting you used the word artist. People don't think of you like that, but honestly, that's what you were doing in a way, is surgically sculpting a little bit.
There's a lot of that. In fact, I always say what I do is art layered on science. You have to know the anatomy. You have to know how people are put together very precisely. You must have a technical expertise. But along the lines of a good jazz musician, you need to know how to improvise. And that's what we do. You come in and you look at a shape and you make changes, and you might modify the process even as you're doing it.
When people come to you with that, predisposition, they already know they want that quick lift or whatever the lift is called. How do you persuade them to say, take a step back and really let's see what suits you? It's part of a consultation you have?
Right. Well, I try to look at it in positive terms. I look at what I can offer an individual or one of my colleagues. Well, I'll just give you a tiny example. For example, the quick lift was devised by an emergency room doctor who was a very astute business person and went into markets and did employ plastic surgeons, but realized what would touch people's emotion to get them to come to them. And I will tell women, be honest with yourself. You want someone looking up, when you look up and you're being cared for, that you look to who you trust. And you find those people by direct referral, by referral from another patient, or by your physician. You don't find them from a good marketing strategy. And we're in a big city, but we're not in a city so big that you don't know someone who's had a happy result. I say you go find those people, ask who they went to, and go to somebody they trusted.
That's interesting. That sounds like your philosophy of how you approach this with your patients.
I do. I think the most important thing we physicians can do is be compassionate, but be honest, both in what we can do and maybe as importantly, in what we can't do for people. Establish a good relationship, and the rest all flows.
A realistic expectation in the end.
Absolutely.
That's really good advice. And I'm sure of all of these things, it is surgery. There is a bit of recovery then, too. People have to expect that as well.
Right. And as people are very different, the techniques we use are more or less invasive. We have smaller procedures we can do that make a nice change in the outpatient setting in a couple of hours under a local anesthesia. It's amazing what you can get done in just a few hours that are quick recoveries. You may take a long weekend, you may take a few days off of work, depending how physical your work is. And then some people have big heavy necks and a lot of the words you don't like, jowling.
Yeah.
And we may need to do a little bit more, and we may see a 3 to 4 week recovery period. So again, just as people are different, the recovery periods are different.
Dr. Treece, that's great advice. Thank you so much for joining us.
My pleasure.